Hi, my name is Qaiser and I did my special study module in female cancers. My presentation will be on axillary lymph node clearance in breast cancer. During the presentation, I will talk about introduction, background, indication for sentinel lymph node biopsy, and axillary lymph node clearance, surgical technique used for axillary lymph node clearance, breast cancer prognosis after axillary lymph node clearance, risk versus benefit analysis, advances in surgical approach, importance of MTT approach, and conclusion. Looking at statistics, 1 woman in 8 will be diagnosed with breast cancer in her lifetime. Breast cancer is the most common form of cancer and the second biggest cause of death from cancer among women. Risk factors and causes of breast cancer include increased breast density, use of oral contraceptive, HRT after menopause, alcohol intake or tobacco, early menstruation in late menopause or obesity, late childbearing, gene mutations such as BRCA1 and BRCA2, and family history increases the risk of breast cancer. So the lymphatic system is made up of organs, vessels, and tissues. It contains lymph fluid, which carries away the waste and toxins, and contains white blood cells, mainly lymphocytes, which plays a key role in immune system. So majority of the lymphatic drainage of the breast tissue happens in axillary lymph nodes, which makes it the most likely site of the cancer metastases. So if any woman comes in clinic with suspicious breast mass, she is referred for triple assessment, which consists of clinical examination, which involves thorough history taking and physical examination, imaging, which involve ultrasound imaging and mammography, and pathological examination, which is core cut biopsy and fine needle aspiration cytology. Now we will talk about indication for sentinel lymph node biopsy, but before we need to understand what is sentinel lymph nodes. Now, sentinel lymph node biopsy are the first lymph nodes to which a tumor is most likely to spread. So in sentinel lymph node biopsy, only the first 1 or 2 lymph nodes to which which receive the lymphatic drainage from the breast tissue first are removed, in comparison to axillary lymph node clearance, where all of the axillary lymph nodes are removed. When it is needed, when patients have clinically negative lymph nodes, so they're not palpable, negative axillary imaging, so imaging of the axillary lymph nodes look normal. Patient in early stage breast cancer, so if it's T1 and T2, so it's less likely to spread to the axillary lymph nodes. And to monitor the neoadjuvant therapy response, so sometimes patients with breast cancer are given chemotherapy before the surgical removal of the cancer to shrink the size of the tumor. Alongside that, another benefit of the neoadjuvant therapy is that it can sometimes kill the cancer cells in the lymph nodes, preventing the need for axillary lymph node clearance, as well as a result, reducing the risk of complications. And we can just do the sentinel lymph node biopsy, removal of the first 1 or 2 lymph nodes to ensure that cancer has not spread beyond these lymph nodes. What are the indications for the axillary lymph node clearance? When the patient have clinically positive lymph nodes, so they are palpable. And after the removal of the axillary lymph nodes, they are sent for pathological examinations in the lab, and that helps for the staging and diagnosis of the breast cancer, for treatment planning, for prognostic information, for risk stratification of the patients that helps put patients into different risk groups and formulate the treatment plans accordingly. And axillary lymph nodes are indicated in certain types of the breast cancer, especially such as when patients have positive sentinel lymph node biopsy, so that ensures that the cancer has spread through the first few lymph nodes, and that requires the need for more aggressive procedures such as axillary lymph node clearance when patients have triple negative breast cancer and HER2 positive breast cancer, which is more of an aggressive form of the breast cancer and is more likely to spread to axillary lymph nodes. So surgical technique used for the axillary lymph nodes is an open surgical technique. Medial pectoral pedicle is a major landmark used during the procedure to identify the neurovascular bundle, such as axillary vein, an artery, long thoracic nerve supplying the serratus anterior, and thoracodorsal nerve supplying the latissimus dorsi. Identification of these neurovascular bundle helps prevent the damage to these structures, which prevent the risk of complications after the procedure. So axillary lymph node clearance happens in 3 levels: level 1, dissection, level 2, and level 3. So level 1 dissection is when surgeons remove the lymph nodes lateral to the pec minor, and that is the removal of the lower axillary lymph nodes. Level 2 is when the removal of the lymph nodes takes place between the pec major and minor, and that is the removal of medial axillary lymph nodes. And level 3 is the hardest one because lymph nodes can reach up to extend up to clavicle. It is the removal of the lymph nodes medial to the pec minor, and it is the removal of the lymph nodes are the higher axillary lymph nodes. Looking at the prognosis of the breast cancer after the axillary lymph nodes, we can look at the image on the left. The higher the level of the axillary lymph nodes clearance, that is level 3, the lower the survival percentage. In comparison to node negative breast cancer patient, when the cancer has not spread to the lymph nodes, they have a better survival percentage. But if we want to compare the patients with or without axillary lymph node clearance, represented by the green and blue lines, we can see that the patients with axillary lymph node clearance has slightly better breast cancer specific survival in comparison to the patient without axillary lymph node clearance. Risk and the benefits of the axillary lymph nodes. So starting with the risk, lymphedema is the most common complications after the axillary lymph node clearance. This is because of the damage to the lymphatic system. This can lead to the cosmetic changes such as swelling and scarring, and it can lead to the lifelong psychological impacts on the patient. Nerve damage, as I mentioned, long thoracic nerve damage can cause winged scapula. Latest thoracodorsal nerve damage can cause restricted arm movement such as loss of the extension, loss of adduction and medial rotation of the shoulder joint, and pain and discomfort. Patient can end up with seroma formation and infection due to the surgical site contamination, and they can have bleeding and hematoma. Benefits involve that we achieve local control by removing potential lymph nodes and reduces the risk of recurrence. Axillary lymph nodes clearance helps identify the high-risk patients and help formulate aggressive treatment plan. It helps determine the prognostic outcomes. It helps in planning personalized treatment plans. It helps stage breast cancer by looking at the level of the lymph node involvement. So the higher the level of the lymph node involvement, the more aggressive the breast cancer will be. We have to consider the advances in surgical approaches. So we have role of the robotic surgery and the axillary clearance that can help reduce the damage to the surrounding tissue and nerves. We can do targeted axillary dissection, which is also called selective lymph node dissection, alongside that sentinel lymph biopsy, and it is called the Dior technique. So surgeons can remove the sentinel lymph nodes as well as the surrounding lymph nodes, surrounding the sentinel lymph nodes by using a black dye before the procedure, before the operation. Surgeons can opt for axillary reverse mapping and immediate lymphatic reconstruction to reduce the damage to the lymphatic system. And we can use neoadjuvant chemotherapy before the operation to reduce the size of the tumor as well as kill the cancer cells in the lymph nodes and prevent the need for axillary lymph node clearance. We have to appreciate the MDT approach, which helps achieve comprehensive assessment for the best possible outcomes of the patient. It helps formulate a patient-centered treatment plan. It helps reduce treatment morbidity and plan rehab strategies for optimized outcomes. And it helps provide patient education and informed decision making through delivering information about procedures, expected outcomes, and possible side effects. So in conclusion, axillary lymph nodes is the removal of the lymph nodes from axilla in extensive breast cancer. We have spoken about the clinical impact of axillary lymph nodes such as lymphedema and the benefits of the axillary lymph nodes, advancements and future directions such as targeted axillary dissection and role of robotics. And we have appreciated the MDT approach for patient-centric delivery of quality care. These are the references used during this presentation. Thank you very much for listening. If you have any questions, please feel free to email me.